still we are keeping the sixth house continue. Today we'll take the sixth house as the disease. Okay, you give the
Okay. Yes.
heading
Great.
disease
Okay.
and the nature of disease and the part of the body. Nature of disease and the part of the body in cuspal interlink astrology, how we will check it.
Okay. So disease and nature of body. Did you
Okay,
say?
disease,
Yeah.
nature of disease and the part of the body. Which part will be affected by the disease?
Ah, yes. Perfect. Okay.
Nature of disease and the part of the body.
Okay.
So it has been made very easy. I'm sharing a chart here. We'll do practically in this case. See, here is the chart. You got
Yes,
it?
I can see. Yes, I've got it.
Okay. Wait. See, this is a chart, and we'll try to find out will the disease will occur to this native or not. If the disease will occur, what will be the body part affected, and what is the nature of the disease he will have to face.
Okay.
Okay, for occurring a disease, ascendant subsublord must get linked with the sixth house or the eighth,
Okay.
because the house of disease is six and the eighth is the house of serious sickness.
Yes.
Okay, now then we see the sixth house, the primary cusp. It should also get
Yes.
linked. Okay, now what is the first point? You kindly note down number one.
Yes.
How to identify the disease and how to check the part of the body. Number one, you write down the ascendant of the example chart
Yes.
is rising in Libra sign at 21 degrees. Okay.
Yes.
If ascendant is at 21 degrees in Libra sign, so the nakshatra rising will be the Vishakha. You know it?
Sort of, yeah. I don't remember this off by heart from Nakshatra,
Okay,
but
okay.
I've got a list.
It can be seen here. See the cusp one.
Yes.
You see my cursor. Cusp one, the Vishakha nakshatra is rising.
Oh, yes, yes, yes. Okay.
And see, the lord of Vishakha is Jupiter. See here.
Yes.
So write down the nakshatra rises on the ascendant is Vishakha. 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 This is the
Yes,
Vishakha.
Vishaka. Yeah.
Okay. Now number two, you have to note down. You have to note down the disease and the part of the body given by Vishakha. The disease and the part of the body given by Vishakha. Okay.
Okay. Okay.
Now it is given in this software only. See, we will go to the reference. This is a reference.
Yes.
Select reference, then select significations, then nakshatras.
Okay.
Okay. Then select here, see the nakshatra Vishakha.
Yes.
Now on the right hand side, you select the disease.
Yes.
So Vishakha nakshatra, see this is Vishakha and these are the disease. Vishakha nakshatra gives the womb disease, nose bleeding, renal stone. Write down here. You note down these the diseases. Okay, your third point is, the first point is the Vishakha nakshatra is rising on the ascendant. Number two, you have to note down the body parts and the diseases given by Vishakha. Okay?
Yes.
See, Vishakha diseases are these. You can write down from here only. Now, I'll check the body parts. What are the body parts? So, body parts given by the Vishakha: lower abdomen, bladder parts, kidney, pancreatic glands, bladder, urethra, genital, rectum. So, third point, you note down the diseases given by Vishaka and the part of the body given by the Vishaka. Okay?
Mm-hmm.
Now, our next point is check the subsub-lord rising on the ascendant. Number 4 point, check the subsub-lord rising on the ascendant.
Yes.
Here, the ascendant subsub-lord is Sun.
Mm.
Write down, next point. Number 5, ascendant subsub-lord is Sun.
Yes.
You have to note down the body parts, write down. Note down the body parts and the diseases given by the Sun. Okay? You can check it from here only. The list is given here. The next point is, you have to see number 7, Sun is posited in Cancer sign. You see here, this is Sun.
Yes.
Sun is posited in the Cancer sign.
Mm.
Write down. Sun is posited in the Cancer sign. See, what is the nature of the Sun? Sun is fiery and hot.
Mm.
Sun is fiery and hot, and Cancer is watery and cool. Cancer sign is watery and cool. And
Mm.
sir, what happens when fire and water meets? The steam
Mm.
occurs. Okay, it means the boils will occur in the body. Means there will be the swelling in the joints. Okay.
Okay. And is that
Now,
written somewhere, or is that just you making an interpretation of those things?
no, sir. See, we are using the signification of the planets. We said, Sun is fiery and hot.
Yes.
When Sun is posted in the moon sign, the Cancer sign is watery sign.
Yes.
And when fire and water meets, what happens? The boils, the steam will occur. The steam will be produced. So what effect will be in the body? The body will be swelling.
Ah, yes.
The joints will be swelling.
Okay.
Okay. Now you come down to our Kaspal. Write down. Sun is in the star of
Sun's in the star of Saturn.
Saturn. Write down. Sun, arrow. Saturn. Dash Venus, dash Rahu. You are saying Sun is in Saturn star. So do you see Saturn in 6 or 8?
Yes, 6.
Saturn is there in 6 very strongly. It
Yeah.
means
Mm.
the ascendant subsum lord has involved the disease house, the 6th.
Yes.
It means ascendant will have to face the disease. Okay?
So it's it involves 6 or 8.
Haan.
Yeah.
ठीक है ना? Because both are houses of disease. 6
Yes.
is the house of ordinary and 8th is the house of serious sickness or the surgery.
Mm.
Now, Sun is in the sub of Venus. Check.
Yes.
Sun is in the sub of Venus. Okay. Now, Mr. Jason, Venus will tell the part of the body. Where Venus is appearing in the cuspal position, Venus will tell the part of the body where the disease will affect. Check. Does Venus appear in 1?
Yes.
Write down 1 below the Venus. See, Venus is appearing in 2.
Mm.
Venus is appearing in 3 also. Venus is appearing in 4 also.
Yeah.
1, 2,
5,
3, 4, 5.
7,
Okay. 7,
8.
8, and 10.
10. Yeah.
Enough. Okay. It means the ascendant sub-sublord Sun has involved the Saturn. And Saturn is appearing in the sixth cuspal position, means ascendant through the star lord has linked with the sixth house very strongly. Okay.
Yes.
And the Venus, the sublord of the commitment planet, will tell about the part of the body where the disease has to attack. So
Yes.
the part of the body will be one. One means head, two means eyes and portion. Number third, shoulders. Four, lungs. Fifth, liver. And seventh, our private parts. Eight is rectum. And 10 is our knees. Okay?
And that is in the references too, right?
Reference to?
So those cusps that you just talked about,
Uh-huh.
one is head, two is
Yes. This is in the journal chart. See, one represents the head. In
yes,
astrology, number one represent the head. Number two is my eyes portion here.
eyes.
Number third is my shoulders. Fourth is
Yes.
upper chest, lungs and heart. Five is liver.
Yeah.
Sixth is abdomen. Seventh is my private part. Eight is my rectum. Ninth is my thighs. 10 is
Yes.
my your knees. 11 is shin moon and 12th is the foot.
Okay.
It is in the natural zodiac, the parts are given like this.
Yes.
When you go for a natural zodiac, you will find the parts there. Okay, means ascendant sub-sublord is linking with the sixth house at star level. It means this ascendant has to face the disease. And the disease will affect these parts where the Venus is appearing. And at final confirmation, it is Rahu. Now,
Yes.
Rahu will tell whether the disease will be recovered or not. See, the houses of disease are 5 and 11. Okay?
Yes.
The houses of disease are 5 and 11. Now you check, does Rahu appear in 5?
No.
It is appearing, sir. Rahu having PS.
Oh, sorry. It's yes.
It is the
Okay.
resident of it. And Rahu is nowhere appearing in 11. Okay?
Yes.
Does Rahu appear in 11? No.
No.
So Rahu represents in this case?
Rahu represents June and Jupiter.
Jupiter. Write down Jupiter also. Now check Rahu in 6 or 11, 6 or 12.
Can you just give me one? Can you just give me 1 minute, Mr. Chinese? Someone's trying to call me. Just give me 1 second.
Okay.
Hello? Sorry, someone's trying to find my house to find my wife, but they're in the wrong place.
Okay. No problem.
Just give me 1 second.
Okay. Sure.
Sorry about that.
Okay. Shall I continue?
Yes.
Okay.
Yes.
Now, the final confirmation planet is Rahu and Jupiter. Now, Rahu and Jupiter will tell whether the disease will be recovered or not. If Rahu and Jupiter appears in 5 and 11, the disease will be recovered. If Rahu is not appearing in 5 and 11, it is appearing in 6 or 8 or 12, then the disease will not be recovered. See, Rahu is appearing in 5. You have noted down.
Yes.
Now, Rahu is not appearing in 11. Okay?
That's right.
Now, Rahu represents Jupiter. Jupiter is also appearing in 5, the house of recovery. Write down.
Yes.
And Jupiter is also appearing in 11.
Yes.
But Jupiter is also appearing in 6 and 12. Jupiter is also appearing in 6 and 12.
Mm.
So what will happen? The disease will not be recovered. The disease will be a permanent nature disease.
Yes. Okay. So it
When
has to
6
be 5 or 11.
at the final confirmation,
Yes.
without 6 or 8 or 12. So in this case, ascendant does not promise the recovery fully. This is the
Yes.
disease of the permanent nature. So we just have studied the potential of the ascendant. Okay.
Yes.
Next, write down. Similarly, in the similar way, we will read the promise of the sixth house, the primary cause for disease. Write down the promise of primary cause in bracket 6. Write down the same. We will follow the same steps. See, the sixth cusp rises on Pisces sign. This is sixth Pisces at
Yes.
26 degrees. Means it is in the Revati star. Revati nakshatra is there.
Yes.
Okay, the last one, the 27th nakshatra is Revati. Okay,
Yes.
write down. Number 1. On 6th cusp, Pisces sign rises on 26 degrees. Means it is in Revati star. It is in Revati star.
Mm-hmm.
Then number 2,
Oh.
note
Actually,
down.
just sorry, Mr. Chani. I've just got to tell my wife to
Okay,
go and
okay,
get something. Just I'll be right back. Sorry.
okay, no problem. Back.
Yes, I'm back now.
Okay, so again sharing a chart with you. Sir, see, on 6th house, Pisces sign is rises at 26 degrees, means it is the Revati star. Note it down.
Yes.
Number next, note down the body parts and the diseases of Revati. Note down the disease and the body parts of the Revati nakshatra, as we have done in the case of ascendant nakshatra Vishakha. The same is the procedure.
Okay.
Number 3, check the sub-lord of 6th house. Number 3, write down. Check the sub-lord of the 6th house. Cusp.
Yes.
What is that? The sub-lord of 6th cusp is Saturn.
Saturn. Yes.
Write down. Number 4, the sub-lord of 6th cusp is Saturn.
Yes.
Number 5, Saturn is posted. Saturn is also posted in Cancer sign. You see here in the planetary position chart. This is Saturn. It is posted in the Cancer sign.
Yes.
Write down. Saturn is also posted in the Cancer sign. Sir, now what is the combination? See, Saturn is an airy sign
Yep.
and Cancer is a watery sign. What does it mean? There is a combination of air and water.
Mm.
In the case of ascendant, it was fire and water. Correct?
So air and water.
Air and water means, see, why when you spread your cloths, the wet cloths in the air, what it happens? It dries up
Yes.
due to the air. It means here the watery contents will be dried up. The disease like arthritis or the joint stiffness is there because the grease will be over. The lubrication will be not there in the joints. So person gets the arthritis type disease. Okay.
Okay.
Now, come down to the 6th subsublot Saturn and check the planetary position of the Saturn. Saturn is in Mercury star, Ketu sub and Mercury sub. So write down.
Yes.
The 6th subsublot Saturn, arrow Mercury, dash Ketu, oblique Mercury, oblique Sun, dash Mercury. Saturn is in Mercury star.
Yes.
Ketu sub and Mercury sub. Now, Mr. Jason, see, in the case of ascendant, the sublord Venus, the commitment planet, was showing the part of the body where the disease is likely to suffer, likely to attack. But in the case of 6th, the primary cusp, at the involvement level, it is Mercury. Saturn has involved the Mercury. Now, Mercury, where it will appear in different cuspal positions, the disease will occur on those parts of the body. Okay, at the involvement level. Now check Mercury is appearing in which houses, which cusps. See,
Sorry, I'm just writing this down. So Mercury.
sir, you have to check the Mercury in different cuspal position. It
Yes,
will
Mercury.
tell, it will 6th house will tell you the part of the body where the disease has to occur. Mercury is appearing in 2. Write down 2 below the Mercury. Okay.
Yep.
It is not in 3, not in 4, not in 5. It is in 6.
Yes.
Write down Mercury 6. And Mercury is there in 9.
Yes.
And 10 and 12. So the 6th house indicates second part, the 6th part, the 8th part, the 9th, the 10th and the 12th part of the body.
Yes.
While reading the primary cusp, the involvement planet will tell the part of the body. Okay? See, again listen. Ascendant subsublord is Sun. Okay?
Yes.
And Sun has involved the Saturn, Venus and Rahu. Saturn is appearing in 6. It means the Sun has got linked with the house of disease.
Yes.
Its sublord, the commitment planet Venus, will tell the part of the body.
Yes.
As we have mentioned. And the final confirmation planet Rahu and Jupiter will tell whether the disease will be recovered or not.
Yes.
In the 6th subsublord case, the 6th subsublord Saturn is in Mercury star.
Yes.
The involvement planet is Mercury here.
Yes.
And where Mercury will appear, it will tell the part of the body.
Okay.
Okay. And
so in this case, all of these parts.
Yes, all these parts. Now, what you have to do, you have to check the Ketu. Whether Ketu is enhancing it or not. Means, does Ketu favor the disease or not? You check Ketu in 5 and 11. Does Ketu appear in 5?
Ketu is not in 5.
In 11?
And
no, it is not
11,
in 11. And but it is not in 6, not in 8, and not in 12 also. Ketu represents?
Ketu is also with Mercury.
Mercury and Sun. See, Mercury is there in 6. Mercury is there in 12. Write down below the Mercury, you write down 6 and 12. And Mercury is not in 5 and Mercury is not in 11. Now, Ketu represents Sun also. Check Sun, sir, in 5 and 11.
So Sun is in 11.
Not in 5. It is appearing in 11. Write down 11. So what it will do, the 6th house subsublord Saturn has involved 2nd house, 6th house, 8th, 9th, 10 and 12, and it is being committed by Ketu, Mercury and Sun Mercury and Sun are indicating both the houses of disease as well as house of recovery. But the final confirmation will be done by the Mercury. If Mercury appears in 5 and 11, the disease is recoverable. If the Mercury appears in 6 or 12 or 8, the disease will not be recovered. So Mercury, you have already seen, Mercury is there in 6 and 12.
Yes.
And Mercury is, you see, not appearing in 5 and 11. So what do you say? The disease will be of the permanent nature. It is not curable. Means the disease will be the chronic one. Now, see, Mr. Jason, the next point. Ascendant subsublord has indicated different parts of the body. Okay, ascendant
Yes.
subsublord indicated 1, 2, 3, 4, 5, 7, 8 and 10th part. And whereas the 6th house indicated the different part, 2nd, 6th, 7th, 9th, 10 and 12. Now you have to find out the common houses which is available in ascendant and in the 6th house. The disease will occur on those part particularly. Check what are the common houses in ascendant and the 6th.
We have 2, 8.
8 is not there.
And 10.
8,
So 2
and 10.
2 and 10,
See,
yes.
you have to find out the common houses. So write down the common houses and 2 and 10. Write down the common houses between ascendant and Saturn. The 6th is 2 and 10 parts. Second part of the body is your eyes portion. Correct?
Correct, yes.
And 10th part is your knees.
Mm.
And similarly, you have to find out the common diseases between the Vishakha nakshatra and the Revati nakshatra and the sun signification and the Saturn signification. You have to find out the common 4, 5 diseases, which is appearing in Vishakha and Revati also, which is appearing in sun and Saturn also. Okay. So his most affected part will be 2 and 10. This particular native will suffer second part means the eyes portion and the 10th part means the knees portion. So it will be a chronic disease. See, once you start wearing the specs, it will never disappear. It will never be removed. You will have to go for the cataract surgery or the other. And if your knees get arthritis or the swelling, it is never going to be recovered fully. Either you will have to go for the knee replacement or you will have to apply the ointments or the injections you have to take.
Okay.
Understood, sir?
So can I just go through this again?
Which point?
So I'm just going to start again. So the rule for, if we're looking at disease nature of
I tell you again, you write down. See, first of all, you have to note down the star rising on the ascendant. Okay?
Mm-hmm.
You have to note down that body parts and the diseases given by that star lord. In this case, Vishakha is rising.
Yeah, so we note down the body. So
okay.
So we note down the star rising of the ascendant.
And check the sub-lord of the ascendant. Note down the signification of the ascendant sub-lord, the body parts and the diseases given by the planet. In this case, the sun is the ascendant sub-lord. So you have to note down the body parts and the diseases of sun. Okay?
Yes.
Now, in this case, ascendant sub-lord sun is posted in the Cancer sign. You have to note down the body parts and the diseases given by the cancer. Then you will find out the common diseases. Okay?
So that is and that is the sign of the ascendant subsublord.
No, the star of ascendant. Sir, yes, the sign of ascendant subsolid. Yes, correct. Ascendant subsolid is Sun. It is posted in the Cancer sign. Correct.
Yes.
Similarly, we will go and check the sixth, the primary cause of the disease. What is the star rising on the sixth?
Mars.
Okay, it's the Revati, Mercury. Because the Pisces sign is rising. Correct? Sir, all the points we have noted down, you feel any difficulty, you tell me.
No, so what I'm looking for is the rule itself, because I wrote down, but we used that specific example, Sun. But I think what I'd like to do is to write down.
See, Sun you have to note down the disease given by Sun and the body part given by the Sun. Okay, it will be, you can take it from the references. You go to reference, signification, then the planets. Here the Sun, and here I will all see. What are the body parts? Heart, bone, stomach, constitution, blood. And what are the diseases? These are the diseases. You have to note down from here.
Yes.
Okay.
Understand.
Okay. Again, everything is given here. You have just to go there and note down it. Then you will club all. See, whichever the disease and the body parts are available in all, which are appearing in the common. So you have to take that only. See, in this case, the disease will occur in second and the 10th part. The other parts will be less affected. The other parts will be less affected. Okay?
Yes.
Okay. Any other point you want to discuss?
No. So I've got this example here, but what I've been doing is I've been writing down Sun when I should have been writing down, for example. So step one is we note down the star rising of the ascendant.
Correct.
Okay.
You have to note down the disease and the body part of that star. In this case, the Vishakha nakshatra is rising, Vishakha star.
Yes.
So you have to note down the disease and the body parts of the Vishakha. Correct?
Okay. And then we note down the sub-sublord of the ascendant.
Yes, that is the Sun.
Yes, and then we do the significations of Sun.
You have to note down the body parts and the diseases given by Sun. Same as in the case of Vishakha. Correct?
Yes.
Then Sun is posted in the Cancer sign. Then you will note down the disease and the body part given by the Cancer.
Yes, but we're talking about Sun, so that means the ascendant subsublord.
Yes, ascendant subsublord Sun
is deposited in.
Yes,
because I'm just looking for the general rule rather than the planet.
This is the general rule. See, and the same is applicable to the sixth subsublord and the sixth nakshatra.
Yeah.
Okay, sixth subsublord is Saturn and sixth nakshatra is Revati. You have to note down the disease and the body parts of the Revati. Then you have to read the body parts and the diseases of the Saturn, and Cancer you have already noted down. So you will club all these and you will find a common disease and the body parts. There will be 3 or 4 or 5. Okay, this is a laborious job. So, but through practice you will come to know.
Yes. So sorry, Mr. Charney, I've just got to make sure I get this right. So you note down the body. So we got the ascendant subsublord, and we note down the body parts and diseases of the ascendant subsublord.
Okay.
And then we look at where the ascendant subsubloid is posited, and I didn't write that down. Is
Yes,
posited
in the Cancer sign in this case.
in what sign? In what sign? Sign of. So we get the sign, and then we go right. So it's a air or water or earthy sign.
According to the what is the signification of the planet, whether this is earthy or airy sign or the watery sign. Okay, what is the nature, the tattvas?
Okay. And when we compared so then we remember we ended up with air or water. So we got this ascendant subsubloid, but did we do the same thing for the
sixth?
Okay.
The same procedure will be followed with the sixth. The sign rising on the sixth cusp is Pisces.
Yes.
At 26 degree means when a planet, when the cusp is at 26 degrees in Pisces sign, the Revati nakshatra is the last nakshatra will rise.
Gotcha.
Okay. So kindly remember the signification and the names of the nakshatras.
Yes.
So you have to note down the disease and the body parts of the Revati.
Yep.
Okay. And then the sixth subsublord is Saturn. Saturn again is posted in the Cancer sign. You note down the body parts and the diseases of the Saturn. So you find out the common disease and the common body parts among these. Among means among the nakshatra, among the sublord, among the sign. Okay.
Yes.
Then ascendant subsublord is Sun. Sun is in Saturn star. It has involved the sixth house, the house of disease. It is in the sub of Venus. And Venus will, the commitment planet, Venus is the commitment planet. Venus will tell the part of the body where it will appear. In this case, Venus is appearing in first, second, third, fourth, fifth, 7, 10 and cuspal positions. Correct?
Yeah, correct, yes.
And similarly, the subsublord will tell whether the disease will be recovered or not. So that is Rahu and Jupiter. So Rahu and Jupiter are appearing in 5 and 11. But Rahu and Jupiter is also appearing in 6 and 12. Which makes the disease of the permanent nature. Okay, if Rahu and Jupiter is not in 6 and 12, if it is appearing in only in 5 and 11, the disease will be recovered. In this case, the disease will not recover. Similar is the process we have taken as the sixth subsublord is Saturn.
Yes.
Saturn has involved the Mercury. So involvement house are called the part of the body.
Yes.
And now you have to find common from the Lagna, from ascendant and the sixth house, which are the common parts. So second and 10 parts are common. Means the disease will be severe in 2 and the 10th part. And other parts will be less affected.
I understand.
Okay.
And the final confirmation planet for the sixth, does that what does that
Mercury
do?
Mercury means it appears in 6 and 12. Mercury is not in 5 and 11. It is not appearing in the house of recovery. Mercury is appearing in 6 and 12 means the disease will be of the permanent nature. It will be a chronic.
So the commitment and final confirmation planets play a similar role.
Yes. See, commitment planet will tell the potency, is it increased or decreased? If it appears in the recovery houses, it will lower down the disease. And it is, if it is also appearing in 6, 8, 12, it will enhance it. And finally, it will be confirmed by the final confirmation planet. Okay?
And that plays the same role as the commitment planet, does it? As in,
yes, yes, you can say it. It has to enhance or it has to decrease.
Okay.
Okay. So this is the way you will check the nature of disease and the part of the body. Okay. Now, another example I am taking, a recovery from the surgery. Okay, I am taking another example. So this is the example of Mr. Kuller itself. He was admitted in hospital for prostate surgery. Okay, from the bed of the hospital, he called me and put a question, will I recover fully after the prostate surgery? See, prostate surgery means it is a portfolio of the 7th house and the 8th house, 7th and 8th body part. Okay, so this is the question. See, he was admitted on 2nd of February 2016. So he called me from there, will I recover fully after the prostate surgery? To be scheduled on 3rd of February, the next day. Okay, see the basic data.
Yes.
The number given by him is 13, 13. So this is name is Kulla sir. Will I recover fully after the prostate surgery? This was his question. Now, sir, how to assess it? First of all, we constructed the chart according to the number given by the curist.
Yes.
Right? Number 2, there is no need to change the ascendant because the curist has asked the question about himself. Okay?
Yes. Yep.
Number 3, we will check the genuineness. See, moon itself is the resident of the 8th house, the 8th house of surgery. And moon star is Saturn. Saturn is also positive there. So the genuineness is very much there. Now, sir, see, moon and Saturn is appearing in 5th house also, the house of recovery. And moon and Saturn is also appearing in 11. It means the question is very genuine. What the thought process going into his mind, it has been shown by this, the moon position of this horoscope. Now, the house of surgery is 8th.
Yes.
Now, 8th subsum lord should involve 7th or the 8th portion because the prostate portion is 7th house or the 8th house. It is in our private part. Okay, first of all, we'll see the ascendant, whether it is linking with the house of disease or not. What is ascendant subsum lord?
Yeah, Mars.
Mars. Mars is in Jupiter star and Rahu sub.
Yes.
See, Jupiter is very strongly appearing in 6 and it is the resident of the 6th house.
Yes.
It has involved the 6th house. Jupiter is there in 12 also, the house of hospitalization. Means ascendant subsum lord has involved the 6th. Then Mars is having the positional status also. And see, Mars is there in the 8th. The house of surgery. And Mars is posted in the 7th house where the surgery has to perform. Means there is the involvement of 6 and 8 and Mars is finally in the subsub of Jupiter. Oh, sorry, Rahu. And Rahu again, you see, it is posted in the 6th house with positional status.
Yes.
And Rahu represents here Sun. Sun is there in 11, and but Sun is there in 6 also. It means the ascendant subsol Lord has involved the 6th house and 12th house. It is committed to the 6th also and 8 also. Because Mars is having PS and it is appearing in the 8th. Now, 8th subsol Lord, you check the Mercury, the house of surgery. How it will be seen? Mercury is in Venus star. Write down kindly. Mercury arrow Venus. Mercury is in 8th sub Lord is Mercury. Write down 8th sub below the Mercury. Mercury is 8th SSL. It has involved the Venus. Venus is appearing in 7. Write down 7. It means the 8th sub Lord has involved the 7th house and 6th house also. Okay, and it is being committed by Mercury is in the sub and sub of
Mercury.
Okay, write down Mercury. See, Mercury is there in 6. Mercury is there in 8. Mercury is there in 5. And Mercury is there is in 11 also. So what does it mean? See, 8th sub Lord has involved the 7th part and committed to the 8th, the house of surgery. But it is appearing in 5 and 11, which indicates the recovery. But Mercury appearing in 6 and 8, which will not allow him to for the full recovery. So this is a not good situation. Mercury at the final confirmation should not have appeared in 6 and 12. Because Mercury appearing in 6 and 12, it is definitely not a good situation for the patient. The patient will not recover fully. Okay? Yes. Now, sir, you go and read the 11th sub Lord. What is that?
Sun.
Sun, write down. Sun is in moon star. Mercury sub and Rahu sub. Moon, you see, it is posted in the 8th house, the house of surgery.
Yes.
Sun is in moon star. Moon is the resident of the 8th house. Write down. And Sun is in the sub of Mercury. Mercury is also there in 5 and 11, but it is appearing in 6 and 8 also. Here also, it is not indicating the recovery fully. Because Mercury is appearing in 8 and 6. And what is the final confirmation? Rahu.
Rahu, yes.
And see, Rahu is posted in 6th house with the positional status. And Rahu represents Sun here.
Sun, yeah.
Sun is there in 11 and 6. What does it mean? The partial recovery. He will not be recovered fully. This is a similar case as we have seen in the last example. He will not recover fully. So the same thing happened, sir. It is now 4th year. More than 4 years has been passed. See, generally what happens for the prostate surgery, a patient is back at the home within 3 or 4 days of the surgery. But sir, he had to remain there for 22 to 22 days. And he was operated upon 2 to 3 times. Even then, in 2 days also, he is not 100% correct. He is not well 100%. Because he has got no control over his urine. And what is the dasha running?
Dasha potential, yes. So Sun.
Saturn.
Saturn. Sorry, dirty screen.
So dasha is Saturn. Okay. See, this is dasha. Correct?
Yes. So do we check the sign rising for this occasion?
No. Here the question is very confirmed, na. But he has to pass. He has to undergo the surgery of the prostate. That is very clear.
Oh yes,
No
because
need to.
we already have a date.
Okay.
Yes, I understand.
Now, sir,
Yep.
what was the dasha running? Whether the dasha will give him the recovery or not? See, Saturn is in Mercury star. Mercury is there in 8 and 6. Okay, Saturn is in the sub of Venus. Venus is again appearing in 6, not in 5, not in 11. And Saturn is finally in the sub of Rahu. Rahu is there in 6. So whole of the dasha he will not recover fully. Understand, sir? Now it is more than 4.5 years. So he is still in that position. He is facing that problem.
And so this is that saying that basically until if he's not likely to recover until at least 2033.
Yes, definitely. Because if dasha is not linking with any of the recovery houses, no bhukti can give the recovery.
Yes, I understand.
So this is the
so
way.
Would you then check the next dasha?
Sir, that is Mercury. Mercury is very dangerous for him.
Yeah,
Because
that's
Mercury,
right.
we have already seen it is the sub-lord of the 8th curse, the primary curse.
So in this situation, would you likely tell this person?
He is taking medicine regularly, and whatever the doctor tells him, he follows the instruction. Still, he has very less control on his passing the urine. This is the problem with it. That is why he is not able to move. This is the problem on. Otherwise, he is very healthy.
Yeah.
Because he has no control over the urine, so how he can move? So he will have to at his bed only. And the washroom is very adjacent to the bedroom. Okay, this is the way you will check. See, suppose I tell you, suppose somebody asks, will I recover fully after the surgery? Whether the surgery is of the heart surgery or the liver or the whatever it is, the process is the same.
Yes.
The 8th is the house of surgery. Okay, it should involve the part of the body where the surgery is to be likely to be done. Okay, if 8 sub-sublord involves the 4th house and commits to 5 and 11 and finally confirmed to 5 and 11, the person will be fully recovered after the heart surgery. Because 8th is the house of surgery, 4th is the part of the body where the surgery is likely to be performed. That is the heart portion.
Yes.
And 5 and 11 give the recovery.
So if in that situation, if the 8th house does not involve the 4th, which is the heart, then
no surgery will be performed. No surgery will be performed. Because the surgery has to be performed on the heart portion. So the 8th sub-sublord involves which house? The surgery will be performed on that particular house. Suppose 8th sub-sublord involves the 6. 6 is the part of the abdomen.
Yes.
Pancreas and etc. etc. The surgery will be performed on that portion.
Yes.
Suppose 8th sub-sublord involves the 8th. The surgery will be performed on the rectum portion because the rectum is the 8th part.
So if someone goes in for, say I go in for heart surgery.
Okay.
And I've got a date.
See, there is 2 linkages. First, 4th sub-sublord, the house of heart. It should involve the 8th. And second, the reciprocal. And the surgery, house of surgery is 8. It should involve the 4th house, the house of heart.
And what happens if that doesn't happen? So I've got the surgery. I'm going for surgery tomorrow, but the horary chart doesn't.
If the horary is genuine, if the mental setup or the thought process of a person is correct. See, in this case,
of course.
You have seen in the case of Mr. Kuller, see, Moon and its star lord Saturn, both are posted in the 8th house. This is the strongest urge. And he knows it very well how to give the number. And see, Moon and Saturn, he is talking about the recovery. Moon and Saturn both are recovery, both are appearing in 5 and 11 also.
Yeah, yeah.
So this is the genuineness.
And in that situation, if the chart is not genuine, do you create another chart?
Yes, definitely. See, if the first of all, the genuineness should be there very strongly.
Yes.
Okay.
Yeah, so that I understand that. What I'm a little bit unclear about now is if someone asks a question and the genuineness is not there, do we get them to do we create another chart straight away?
I tell you, if the question is asked seriously, if the question is asked by the curiosity very seriously, the genuineness will definitely appear. If it's taking it lightly and joking, so the genuineness may not appear. Okay?
Yes. And what do you do in that situation?
Sir, you ask him, you tell him, sir, the genuineness does not appear here. You kindly ask this question again sometime after a few days.
After a few days. Okay, I understand.
Okay. So, Mr. Jason, next, I think our 6th house has been completed. We have done all the 6th house. It is very long.
Yes.
Okay.
I will practice this. I think I'm a bit. I will practice this tonight and tomorrow. I think.
Now we will take our next house. We'll taking the 8th house. We have started the 8th house today itself because we have taken the horary related to. And but for 8th house is seen for the other things also, for the house of longevity, the assessment of longevity, and the house of entangled money. Okay.
Oh yes.
Okay. We'll do in the next class.
Okay then.
Thank you.
Okay. Thank you, Mr. Chani. I might have some questions for you next class. We'll see how I go.
Definitely.
Okay.